Okay, so let's look at the second module, the income side of dentistry. Dentistry, it is very simple. So key learning in this presentation, what are the sources of income in our business and how can you improve income? So let's look at this. So very simple. You got income coming in, expense going out, this yields the profit. As we know, our goal is always to improve this bucket, reduce this bucket, which will end up improving this profits. So sources of income. To my knowledge, there are only three sources of income generation in dentistry. The biggest one, I believe, in our business, pretty much all of it, is coming from doctor's chair and hygiene chair. So each $100 we make, $70 comes from doctor side and $30 comes from hygiene side. There is some variation, some it is possible, like you can have it lower, maybe 25-24%. Some offices can be seeing this much higher, maybe 35%. So there is a variation there, but this is a standard industry standard 70-30. The third part is the retail products. When you see an electric brush or whitening kit, it's negligible. I think it may be just few $1,000s for us. So I'm not even gonna talk about that today. It is possible to increase this bucket, but let's focus on primarily these two. How do you improve the doctor's chair side and the hygiene chair side? So again, the makeup of this, doctor, you're getting, this is the full income, $100, 70 from doctor side, 30 from hygiene side. Now here comes the mind-blowing part in dentistry. And this creates so much problem for all of us, right? I mean, for every party, it's nothing but a hassle. Because the primary payer for insured patient is not the patient, it creates a trouble. And the PPO stands for Preferred Provider Organization. I don't think there is anything preferred about the provider. We are called as preferred provider, for example, let's say MetLife or Guardian, but it's in a way it's a prisoner provider. How much leverage do we have over in this relationship? None. I believe just a few years back we bargained and it was very small fee increase, but it's been many years when you see really any significant increase in the fees. And I believe most of the PPO doctors, they understand the pain. So again, there is nothing preferred about this, us being PPO provider. Let's look at the structure of income. I will start with the crown, which is very common and one of the biggest contributor to our income. Our office fee, for example, if it is $1,200, that is our crown fee, for that we call UCR, published rate. Now these are the adjustments that hits the crown when you have the procedure being done. So there's so many adjustments. If you look at that, if the patient is PPO patient, you take that out. If it's a senior citizen, we offer some discount there. If it is just cash paying patient, there's some discount for that. If they're putting this on care credit, then we take a hit there. If it is credit card, there's whatever 3% over there. Now let's say we got some refund for whatever reason, like the experience was not right or it broke. Sometimes you give them partial refund, sometimes even full refund. It's a problem. So there are refunds that go in there. And then you have situation where we never collect the copay. If it was not collected up front, now it goes in the collections, you'd lose money there. So all these scenarios are hitting your money you should be collecting, which should have been, this is the office fee. So this ends up basically what is going in the bank. It could be anywhere from $700 if you are a MetLife provider, you get somewhere around there, $2,050 maybe for cash patients, you got some discount there. So $1,200 crown can bring between $700 to $1,050, and this scenario is pretty much across the board, whether it is your exam fee or it is perio fee or hygiene exam or cleaning. This is the same thing. We take a big hit in the write-offs for most offices. If you're lucky, if you are not into PPO network and just have fee-for-service practice. Good for you. So how do you improve income? So this is the part which we can spend a lot of time, but I'm going to make it very simplistic. My goal here is to not talk about marketing and attracting new patients. It is like in the current scenario where we are today, how can you improve the income from these three buckets: doctor's chair, hygiene chair, and retail. So first you got to make sure that fees are competitive with the market. Each year you should increase fee to keep up pace with inflation at least. Consumer price index goes up by at least 2 to 3% each year. You got to be increasing fees at least by that much. When we looked at the Provident fee few years back, we realized that our fees were much lower compared to the market, and we ended up adjusting some of the fees. Third part is how do the doctors improve their skills so they can do more value-added procedures. So can you add implant? Can you add Invisalign? Do some sleep, sedation? So improving the revenue per patient. So you are not really working on attracting a lot of new patients, which is always great, but how do you optimize your income from the current patient pool? There is a lot of opportunity there. If you are sending to a lot of procedures to a specialist, how can you do in-house? So there is a big room for improvement here, how you can grow this. Then hygiene department, if as I talked earlier, hygiene should be 30% of the practice, and making sure that individual hygienists are performing to the goal, whatever you decide to, and it's overall well-run hygiene department. There's a lot of opportunity in this department. Retail business, I think this is the most neglected side of our office, our business, and there's a lot of opportunity. I totally believe that people will buy more retail product from dental offices if you provide the customized product and right pricing. Personal care, I think you go to Walmart or Meijer and you will have the entire aisle of oral care products. So people are buying these products, just not from us. And of course these are marketing for new patients. That's entirely different topic. We can talk at some other point, but that is the lifeblood of the growth and practice improvement, income improvement. Now finally, this is a lot of people maybe they don't realize, we came across this early on in 2013, adding capacity if that is an issue. So can you add more hours, more days? Can you add some chair? Do you need more providers? And you will figure this out if you are looking at your hygiene schedule, for example, 6 months out, and you don't even see openings, a lot of openings in hygiene, then there is a problem. If your doctor schedule is more than is out, let's say 3 weeks or 4 weeks out, then you need to hire a doctor. You need to get someone on board, or somebody needs to work more hours, open more days. So it gets very nuanced. Do you need to add more prime hours on Saturday or evenings? So this is often a big driver without adding a lot of cost to the business. You just analyze your capacity problem and add the capacity if you need to. Let's look at adjustment side, and how many PPOs have you signed up? Are we really taking every PPO that's paying very low fee? So we got to look at PPOs and drop some of them if they're paying too low fee. Some PPOs, not all of them, but they will negotiate if you have a good track record and you have a lot of patients with that PPO. They will negotiate you. You should be able to get higher fee. Then care credit terms. We offer care credit, but we have to be very careful what kind of terms we offer. If you're offering no interest, 5 years, 3 years, that's a big hit on the income. You're taking almost 15% off, and that is hurting the business. Then credit cards. We just negotiated credit card fee for Novi office a few months back, and they do negotiate, and you save a lot of money. I believe we saved almost $2,000 to $3,000 per year. So that's the money just directly adds up to your bottom line. I believe this is our pet complain all the time with front office, why are we not collecting all copays up front? And it is challenging, but with right language and educating patients right way, there is no reason we should not be able to collecting all copays at the day of service or even before. It will eliminate a lot of legwork later on. Minimizing patient complaints and refunds to patients and insurance. I know that we write sometimes checks to insurance as well. So how do you minimize that? A lot of time we just pick up the Target card and the Amazon card, $25 gift cards, we give it to patients. Why do we have to do that? Because patients was not seen for 10 minutes, they had to wait, or we made some mistakes. So you minimize those mistakes and you save this money on the gift cards. So these are small items, but these are death by 1,000 cuts. You got to look at everything, and once you improve process across the board, these things should improve. Then discounts. I mean, if fees are right, are your discounts too generous? Are you losing money on seeing some of the patients? So all these things will help the bottom line. You'll see the better amount going in. Finally, the strategic position. How do you improve the income side and just reconfigure the practice? So if you look at where we are today, the aging demographics, we have a lot of baby boomers retiring, and we also have a large number of uninsured patients. The whole economy is now gig driven, a lot of independent consultants, a lot of freelancers, and most of them don't have employer sponsored health care or the dental care. So we have a big pool of cash, large pool of cash paying patients are out there, and they are not PPO patients. They are quite a few of them are able to afford good dentistry, and our goal or challenge same time, how do you attract them and drive the practice away from this mix, which is pretty much right now most of the money is coming from the insurance side, and 55-45 ratio, I will say, in our office right now. This is the current mix. How do you go from there to hopefully here some point? So insurance bucket is smaller and patient bucket is bigger, and this can only happen when you have cash paying patients coming to the mix, larger ratio. So that is the simple way of looking at the income side, how you improve that with everything being the same. Final key takeaway: growth means increase in income. Growth is pure numerical number. It does not mean technology investment in everything else. Unless it results in increase in income in the top line revenue, there is no growth. Most practices, I believe, can improve their income in their current situation with same patient pool and no new marketing push. So forget the whole focus on bringing a lot of new patients, which is great. Nothing against that. But have you optimized everything you can do to increase your current income from the current patient pool? And there's some really low-hanging fruits there. Then reducing adjustments that we talked earlier will boost profit right away. So next video we will talk about expense side of dentistry, and that can get a little bit interesting, but this is eye-opener. And thank you for watching this video.